Allison. Hi, Rosie. What brings you guys in today?
So Rosie started coughing. She was doing it like once a day, and now I feel like it's at least a couple times a day, maybe 3 times a day. When I first let her outside is when it usually happens. She'll start like hacking, and then it's almost like she clears her throat and she might like gag a little bit, and then it's gone. And like she's eating fine, she's drinking fine, she's using the bathroom fine, but she's just got this weird cough that's new.
Mm-hmm. And have you changed any of her diet and exercise change?
No, everything's the same.
Has she been kenneled recently?
No.
Okay. Well, let's take a listen. Oh, sorry, Rosie. Respiration sounds great. Okay, Rosie. Worst part. Just get a quick temp. Temperature's normal. Hi, Rosie. Let me look at you. Okay, well, she sounds great. So I think the next best step is to get some blood work and see if we can get a good chest x-ray to see if we can see what's going on.
Okay.
Okay, I'll steal her and we'll be back shortly.
Okay, thank you.
Uh-huh. Come on, Rosie. Sorry to keep you waiting.
No problem.
So we got some blood work.
Okay.
No, unfortunately, Dad won't be back till tomorrow at the earliest. We did happen to get an x-ray. She said still perfect. And interestingly enough, we actually happened to get an x-ray with her coughing, and I think we actually got it on film, her problem.
Oh, wow, that's great.
Yeah, it doesn't happen very often.
So what's going on?
So I think our problem here is a collapsing trachea. I think
It sounds really serious.
it's treatable.
Okay.
So I think she's pretty early, grade 1, maybe grade 2. So I'm looking at, I think, about a 25% collapse right now, which is medically treatable, so that's great.
Okay.
So a collapsing trachea, it's a weakening in the cartilaginous tissue of the trachea.
What is that?
So the rings that make up the trachea are circle. They're made of the same thing that is like your nose, your ear.
Oh.
And as a dog gets older, usually is when we start to see more problems, and the cartilage gets weak. And instead of being round, it more or less flattens out, so air can't get through. So the hacking is them trying to open their airway back up.
Oh, okay.
And I have a couple visual aids because a lot of people don't know.
Okay.
So I think hers is more or less looking about like this.
Okay.
So this is a healthy dog,
Oh,
trachea.
wow.
And then this is the cartilage, the ring.
Okay.
And then as, when they get a collapsing trachea, it more or less flattens. So it's harder for them to get airflow into the lungs,
Okay.
which causes an irritation and causes the hacking.
Okay. Is age the only thing that causes that?
So a lot of things can cause it, or there's more or less a lot of things we can do to fix it. You can use a harness versus a collar, which will help with the stress on her throat, on her trachea. but more or less we don't really know why exactly it happens. It's nothing you did or she did. We see it a lot in dogs her age, in the smaller toy breeds, pugs, chihuahuas, Pomeranians, stuff like that.
Okay, so what do we do about it?
So hers is still early, so we can treat it medically. We can use a bronchodilator, which just increases airflow to the lungs. So it helps open up the airways to get airflow in.
So it doesn't actually make her breathe better, but it just opens.
It helps open the airway.
Okay.
We can also put her on a cough suppressant, which will help decrease the amount of time she's coughing, which will help the irritation on her trachea.
Okay, that sounds good. So are those like oral? Are those pills?
The bronchodilator is a pill. The cough suppressant is a liquid.
Okay.
And usually in, dogs with this kind of great collapse, we usually see great success with medical treatment.
Okay, and can she start those today?
Yeah, she can start those today. We can fill them here, or we can send them to your pharmacy.
Oh, I'll pick them up at my pharmacy. Now, what happens if it gets worse? Like, what do we do?
So, if it gets worse, the next thing that would be able to do would be to look into surgery, which just isn't always the best option, especially for dogs that are starting to get older.
But it is an option.
It is an option if it gets worse. I would recommend visits every 6 months, so we can keep a close eye on her to monitor if her tracheal collapse gets worse.
Okay.
So that we can catch it early, and
And do you guys do those surgeries here?
So we don't offer them here, but we could refer you to a specialist.
Okay. No, that sounds great. So today she starts on some oral medicine.
Mm-hmm.
And
that should hopefully help.
Everything else we keep normal.
We keep normal. And I would schedule a checkup in 6 months so that we can take another x-ray, make sure it hasn't increased any. I would keep an eye on her, monitor her activity, her coughing, and if you notice that it's getting worse or the medications aren't helping, give us a call, as soon as you realize, so that we can, take a look at her so that it's not getting worse and let's not catch it.
Okay, thank you so much. I feel so much better.
No problem. Don't mind at all. Bye, Rosie.
Yeah.